Anyway, things have changed. And in my presentation, what I'd like to do is share with you some experiments. I'm going to call them experiments. Right now, the world is moving so quickly in social media that I find it very difficult to prognosticate and say this is going to work and that's going to work. I think right now most of you are probably experimenting with a variety of different approaches, and so I'd like to share with you some of those approaches. But I'd also like to dig in a little deeper into the why, and specifically share with you some of the notions around this generational shift that is purported to be the biggest generational shift since rock and roll, and that's the notion of the millennials. You all know, the World Health Organization has said it, social media is something that can't be ignored, and everyone is anxious to engage using social media and reach out to their target populations, and we're tripping over ourselves trying to get there. A note that Alex mentioned, I want to reinforce, and if you're taking any notes at all, you'll probably hear from me again. Search engine optimization, to me, has more to do with the notion of engagement and outreach than social media does in and of itself. Having said that, this social media does affect your target populations. So if this ARS, this audience response system, will help us, you answered the question earlier. The 25%, this is Susanna Fox, if you can zip over it for me, would you? Advance it, yeah. Sorry, I'll go back. 25%, according to Pew Research, of the 47% of chronic disease sufferers are using social media. They're using social media clearly for a variety of motivations, and would all like to understand more about that motivation. One of the challenges we face is, as we approach social media, we have difficulty deciphering or identifying the motivations for use. You're doing things, the Public Health Agency of Canada is throwing lots of time and energy toward social media. They currently are using RSS feeds, Twitters, and microblogs of all different kinds. This, incidentally, speaks to another one of the challenges. We're experimenting, and it is not necessarily obvious which one of these strategies is going to pay. So you see the attempt, and I'll throw this at you in addition. Not only is it not obvious which is going to hit the home run, but once you initiate these programs, most of us are puzzled as to how we're going to stop it if it doesn't work. So, these are important questions we've got to answer, and hopefully in these presentations you'll see today we can take a stab at it. We'll look at some very inexpensive approaches, Facebook, LinkedIn, and YouTube. They're all widely used. Now, one of the challenges is control over content. And clearly I didn't have much control over this content because that picture is me in there, and if my wife saw this, she would have laughed her head off. The notion of engagement, using social media for engagement, is something that we're not only experimenting, but we're trying to engage youth and other populations in the conversation. So I don't know how many of you, perhaps you can give me a show of hands, have participated in some shape or form in a focus group that attempted to understand your behaviors on the internet or social media. Show of hands. So there's only a few of you. Well, there were 50 senior business executives in this particular group that the Center for Health Promotion assembled. We didn't have any trouble getting senior vice presidents from organizations such as Google and TELUS and Bell. They're all eager to reach out. Fortunately, I participated in another activity where we were reaching out in the same respect to business on the whole notion of diabetes and the management of information to youth. I wonder if this is working here. here we go. The CDC, I think, has the same sort of approach as FAC, and certainly FAC, I have no doubt, would be looking toward them. I don't know what their budget is, but it's got to be a staggering figure when you take a look at the number of initiatives. What the CDC has understood, however, is that the new generation doesn't have much patience for searching around, and they do have preferences. The diversity of platforms that you have access to needs to be dealt with. Alex talked about one of the central issues in business being customer acquisition. Well, there's another reality, and that is customer experience. So the CDC is trying to serve up information in different ways because they know that the patterns of consumption, particularly among youth, are in full evolution. I said there are inexpensive strategies being experimented. I don't know, 62% of internet users watch videos and clearly the biggest source of, this is the second largest search engine in the world, and the #1 engine for how-to information. So clearly there's an opportunity to use this type of social media very inexpensively. Lots of it's being done. And you'd have to speak to Alex about the rates of success. We're trying to do things. For instance, we'll be putting up a YouTube video. We enlisted Morissette here in the front to take the video. So we're going to be posting a YouTube video ourselves, and we will be measuring its effectiveness. So I don't think that can be said enough. The notion of experimentation, it really does need to be followed with some sort of measured learning, and that's a plug for Alex's business, because otherwise you can spend a ton of money. So we know we need to collaborate, and I'm wondering if there is a group that needs to collaborate more urgently. Would you vote on this question? Who needs to collaborate on chronic disease? And I'm going to add these words, more or most urgently.
Only one choice?
We got 9 seconds.
Only one choice.
Only one choice? Okay.
Oh yes, just one choice, yeah.
Okay.
Yeah. Now, we all would have expected, I think, all of the above. The reality is, I think, a function of your target market. Let's take a look at the importance of an integrated approach. We think that there's no such thing anymore as control. The notion that Jennifer spoke of, the democratization of the internet, we're witnessing it. If you think you have control over the content that you've got, you don't. I don't know if any of you have participated in Wikipedia. Anybody here? Wikipedia? All right, so in Wikipedia now, many of our customers are hiring what are known as wiki jockeys. Have you heard of a wiki jockey? Well, the wiki jockey is someone who watches the entry you make and puts it back when it's changed. So now you have competitors, people with competing ideas. Anyone can go into Wikipedia, they put down their idea, and then someone comes along and changes it. And those changes may be happening 20 times in a given day. So depending upon the time you look at it, you get a different opinion. The reality is that we've lost control over content and, to a large extent, demand and, as Alex pointed out to me earlier in our conversation, the creation of data. So we have to take an integrated approach with the public probably taking us to where they want to go. That puts health practitioners and researchers in a position where they pretty much will be forced to collaborate, particularly with pressure on budgets. That's the advice that we gave the Public Health Agency. When we were asked to help them create a bit of a logic model with respect to information exchange and dissemination, we encouraged them to leverage all public assets. The public assets that I'm speaking about are YouTube and LinkedIn and Facebook.